Mr. Waite, you're recognized for 5 minutes.
Chairman Miller and Ranking Member Brown, Chairman Isaacson, Senator Blumenthal, and other distinguished members of the Senate and House Veterans Affairs Committees. As the Legislative Director of the National Guard Association of the United States, and on behalf of the more than 45,000 members of the National Guard Association and the nearly 500,000 soldiers and airmen of the National Guard, I deeply appreciate this opportunity to share with you our legislative priorities. We also thank you for your tireless oversight you have conducted to ensure accountability and improve our nation's services to veterans and their families. But we must not stop there, as much more needs to be accomplished. As you know, the National Guard is unique among the components of the Department of Defense, as they have both a federal and state mission. When called upon under federal service, National Guardsmen and women always answer the call when asked. Upon being released from active duty, these citizen soldiers and airmen return to their communities, homes, families, and civilian jobs as veterans. So they must train not only for their federal mission, but also be ready to serve their governor on a wide variety of state missions. They live in urban areas, small towns, and rural farmlands. Veteran status is our #1 priority. We hear from many of our members that as traditional drilling guards members of the Guard and have not been deployed through no fault of their own, we're always prepared to answer that call. They may spend 20, 30 years or longer in service to the nation as guardsmen and women, but to not call that person a veteran just doesn't hold water. We owe a special thanks to Congressman Waltz for his tireless leadership in the House, and Senator Heller and Senator Bozeman for their amendments for the special status to pass in the Senate. We encourage you to put this legislation where it needs to be in Title 38, in law, and not just a non-codified provision. These veterans deserve more than just to be a footnote. Many of the issues confronting our National Guard veterans are that many do live in small communities and in some cases many miles from a hospital or a veterans clinic. For these dual mission soldiers and airmen, after serving overseas, disengaging from the units in a quick fashion from war zones, and even a quicker post-deployment station release, makes a jarring, unexpected feeling of loss of camaraderie, support, and an adjustment back to a civilian environment not necessarily experienced by regular service members. Many of these guardsmen and women do not have access to the resources offered to returning active component service members on post or base, such as mental health, counseling, and even good hospital access. It is our desire and our duty at NGAUS to ensure that our members and all Guard and Reserve service members have access to reliable and available care within the VA system, and therein lies the rub. As many small towns and villages are not located within a reasonable commuting distance for VA clinics and hospitals, they must rely on either the chance of a visiting VA mobile clinic or their hometown doctor, who may not be able to assist them with mental health, illness, PTSD, the stresses of everyday life, including family or work-related troubles, or other trauma that may or not be related to deployments and war situations. I believe that these factors are contributing to the suicide rate in the National Guard that is the highest of any service component within the Department of Defense. An interesting study conducted recently by 2 clinical research psychologists and reported by the North Dakota National Guard was that the majority of National Guard suicides were not from members that had been through deployments. Rather, it may be to the dual lives these members lead in their communities, their states, and for the nation when federalized. Many of the suicides in the Guard are young soldiers and airmen who have problems with addiction, financial troubles, and personal social turmoil. Once again, the facilities and mental health professionals available to active service members simply may not be available to the community-based Guard member. Your committees can and do deliver the needed legislation that enables the Veterans Administration and the Department of Defense to establish and pay for these needed programs. To that, we are most grateful, and we applaud your work and ask that you continue the fight for all our veterans, active, Guard, and Reserve. But still, more must be done. From my written testimony, I would like to highlight several bills that have been introduced that the National Guard Association strongly supports this year. I will briefly mention a few of these. S. 1463, amending the Choice Act, sponsored by Senator Moran. S. 717, Community Provider Readiness Recognition Act, sponsored by Senator Donnelly. S. 2120, Veterans Justice Outreach, sponsored by Senator Shaheen. S901, Toxic Exposure Research Act, sponsored by Senators Moran and Blumenthal. H.R. 1331, Quicker Veterans Benefits Delivery Act, sponsored by Congressman Walz. H.R. 353, Veterans Access to Hearing Health Act, sponsored by Congressman Duffy. S. 2049, Establishing a Continuing Medical Education Program at the VA, sponsored by Senator Brown. It's been an honor and a personal privilege for me to come before you and give you the legislative agenda for the FY17 for the National Guard Association of the United States. Thank you, and I'm willing to answer any questions you have.
Thank you very much.